So on Sunday, Montreal had the worst air quality in the world. The culprit, the wildfires burning in northern Quebec. And as the threat of annual wildfires grows, so do health concerns as we deal with all that smoke. Now, I told you earlier on this hour that, I sort of curtailed my activities. I had the air purifier going. I left the windows open overnight on Saturday night into Sunday. And then I turned on my air purifiers to make sure my air quality was a little bit better. But then I stayed indoors pretty much the entire day. When I went out, I went right into the car, drove to a movie theater, and then drove right back. I asked you about your day. Listen to some text messages I got. Elias, I was in St. Sauveur, ready to hike with my daughter, and woke up to a lungful of smoke when I opened the door. So I opted to float around the lake, which was covered with a film of ash. And then one text message from a listener, and I read this note earlier, and I said, boy, this is interesting, because the listener writes, I found it interesting the number of people out there biking, running, and even people with babies and strollers in all that smoke that you could smell and actually see with the naked eye. So let's find out a little bit more about how we deal with this smoke and the appropriate way to deal with all of this. Jill Baumgartner joins us on the line, Associate Professor of Environmental Epidemiology at McGill University. Jill, welcome to the show.
Thanks so much for having me.
Now, that sounds like a fantastic title, Environmental Epidemiology. Tell me what you do.
Yeah, so a lot of my work, actually, it's done outside of Canada in places that are typically more polluted than Canada. That hasn't been the case for the last couple days, but we study air pollution, the sources of air pollution, how much people are exposed to, and then we look at how it affects their health and ways that we might mitigate those health impacts.
So, and air pollution, everything that I've learned, whether doing this show and interviews or everything that I've read, just the amount of deaths that happen because of the stuff we breathe in cities, and we don't talk about it, I think, as much as we should. So how do you view this hopefully temporary smoke that we're getting here in the city? How do you view it? How should we be reacting?
Yeah, I mean, I think it's alarming to a lot of people, and I was alarmed as well. So even, I sort of, like many people, woke up on Sunday morning. I sort of walked by an open window, and I was like, oh, has somebody lit up a fire in the neighborhood? And then sort of looked outside, and you didn't have to have an air quality measure. You could kind of just do a sniff test to get the extent of the poor air quality yesterday. So yeah, it was, I think, for a lot of people jarring to experience air quality like this. A lot of the world's population lives with air quality like this on a daily basis. Huh. And yeah, the health impacts of that are quite staggering. And that's, in Canada, but also in places around the world.
So what should someone in Montreal be doing, whether it's yesterday or continuing into today? Should we, because you mentioned some people live with this type of air every day. We're getting it for a couple of days. Are you staying indoors? Like, even if it's just a day or two, should you be curtailing your activities? Just how serious is this smoke?
Yeah, so I really appreciated your lead in, because I think what you were doing yesterday is what you ideally want to do when you have days like this, right? So I think you might want to have, there's lots of free mobile apps that you can put on your phone to get, especially in summers and falls when we're going to have, increasing number of wildfire events like this. So when air quality is bad, you at least know about it, right? The media does a good job of covering that as well. And I think then you can make informed decisions about what you want to do. So certainly, as was the case yesterday, the advice was, look, don't exercise. Try to reduce your time outside. We saw a bunch of events, triathlons and other events being canceled around the province, and that was a really good decision. But, to the extent that you can, run an air filter, find clean air spaces around the city if you don't have any kind of mechanical ventilation in your home, or you don't have an air filter. Places like you went to the movie theater, right? So there are places that you can go that will have some kind of mechanical ventilation, that will have clean air. But especially you might want to, if you do need to commute, and, maybe the bicycle is the only way that you can get to your job. Pull out those, well-fitted N95 masks that we've been using throughout used throughout the pandemic, and cycle with that. If you're going for a walk, put that on. And this is because it was so extraordinarily high yesterday, even for healthy folks. I think that's the right decision. Now, if you are sort of fall within this vulnerable group of people, if you have asthma or you have other health conditions that we know make you more susceptible to experiencing severe health impacts of air pollution, then finding that clean air space, getting that, air filter becomes even more and more important. So as these events, we've seen them become more frequent in the past few years. As they become more frequent, I think planning in advance for them is going to be important for people that have pre-existing health conditions.
Jill, what do you say to someone who says, you know what, the season to get outdoors in Montreal is so short, and I'm going to play tennis. I don't care if there's smoke because it's just one day. And I think about the health damage of not doing my workout, let's say, versus the health damage of breathing in bad quality air on one day. What do you say to that? How do you make that determination on the balance between physical exercise and breathing in, smoke, which, you can smell it, you can taste how bad it is?
Yeah, I would say, certainly for cases like yesterday, I don't think it was particularly pleasant to be outside. I know there were some people cycling and walking around, but I think it's not pleasant to be out when the air quality is that terrible. And there's really good evidence showing, there's, I think you were talking about the health warnings that came out with the air quality alerts. And it was basically don't go outside, don't exercise. So I think it's important to follow those in the same way that we sort of changed our behavior a bit during the pandemic, right? We don't want a bunch of people getting sick and further overwhelming our healthcare system. We want to keep people healthy. It's not, I understand that people may not want to, they may have their tennis date set or they may have their run that they go on every day and it helps them. But I would say during these really high episodic periods, it's important to find other ways that you can de-stress or try to move around. We are fortunate in this, and to the extent that Canada generally has some of the best air quality in the world. So save those activities for a day where air quality is a little bit better.
What should we learn from the places that don't have that good air? So right now, in worldwide, we're number 3 worst air quality. Kuwait City has the worst air quality in the world right now. Jakarta at number 2. And then as I go down the list, I see Delhi in India. I see Karachi, Pakistan. What do they do in these cities? How do they deal with this being a daily occurrence? How do you live with it?
Yeah, sources are different, right? In some of those places, it may be more industry. Other places, it may be more traffic related. In this case, I think for Canada, we know the source, right? The source is wildfires. And so I think there's things that we can do in terms of, providing, behaviorally providing more clean air shelters for people that need them. Providing subsidies for people who want to purchase air filters. Those kinds of government subsidies can be feasible. But I think more generally, we probably need to start, again, really thinking seriously about these policies and actions to address climate change. So we have really good evidence that climate change is causing these wildfires to increase in their frequency, increase in their magnitude. And so I think we have to, us along with other high-income countries have to be transparent and make meaningful emissions reductions to try and address climate change. And places like Montreal, we have a role to play in that. So we might enable alternative modes of transit around cities, focusing on things like cycling or public transit. And in times when we don't have air quality like this, incentivizing shifts to cleaner and more efficient energy and technologies. This really is the long-term solution that we need to focus on.
Luckily, on that end, everything we see that's happening is particularly in the West, where we are adopting clean energy solutions. There's one aspect to that. Jill, we have to leave it there. Thanks so much.
Thanks so much for having me.
Jill Baumgartner is an associate professor of environmental epidemiology at McGill University.